3:20 on AM 800. Welcome back to the afternoon news. It's not long now, just a few weeks, about a month or so, classes will be back at area schools. One concern for parents is keeping their children free from coughs and colds. For a few tips to keep your kids virus-free in classes, I reached out to child health expert and pediatrician Dr. Dina Kulik. I think one of the things that a lot of parents are concerned about is, well, they're going to be in there with a bunch of other kids. Those kids may not be as healthy as mine, or they may have some sort of a cold or sickness. What are some of the things that we can do to help our kids and to help ourselves avoid kind of getting into one of those sharing of diseases things?
For sure. So it's 100% the case that we have more viruses during the fall season. When kids go back to school, they're touching each other, they're getting exposed to one another, and we're in closer quarters. So viruses definitely go rampant during the fall season. You certainly want to keep your hands clean, and that's the same for you as an adult, but also for your children. So making sure that they're washing their hands frequently, ideally with the same amount of time as it takes to sing the song Happy Birthday. So you need about 30 seconds, if not more, of soap and water or hand sanitizer to really clean all those bugs off of your hands. And then even if your hands are clean, you want to make sure that you avoid touching your face all the time, because the germs that are causing viruses and bacterial infections are coming through your nose, your ears, your mouth, your eyes. So you want to keep your hands off your face. Those are big, easy ones to avoid. And certainly washing, after using the washroom, before eating, after sharing things with your hands, using public telephones, public washrooms, etc. You definitely want to keep your hands the most clean at that point. And then teaching your kids not to share so much. So obviously it's a very good life skill to learn how to share. But when kids are sharing utensils and cups and food, you're passing on those germs from your saliva, of course.
You included a kind of a cute picture of a kid with his finger up his nose, something we see on a fairly regular basis, I think, if you have young kids. I guess that's one of the things. Don't do that.
Yes, keep your hands away from your face. I mean, easier said than done. Kids touch their faces a lot, and they're constantly picking up other toys of other children and putting them in their mouths, which is why toddlers get sick so frequently, because they're always sharing. And we teach them to share, but there's some things you don't want to share, and you want to keep your hands away from your face for sure. You want to consider having your kids fully vaccinated. There's plenty of different viruses and bacterial infections that are vaccine preventable. And come flu shot season, around October, November, that's a huge one as well, because the flu can make you very sick. Lots of people actually die every year from the flu. And kids, young kids, and elderly people are most at risk of getting particularly sick from the flu. So making sure your kids are up to date before they start school or daycare this year in the summer is a good time to see your doctor to make sure that they are up to date.
Yeah, for no other reason than to avoid the rush, because at some point, and we do the story every year about a number of children who are being excluded from school because they don't have their shots up to date, because the health units will track those things. Get ahead of the rush. Don't be lined up and have your kid miss class because you didn't get these shots in time.
100%. And as we see more viral illnesses during the fall, your doctor's office will get more busy and the wait times will probably be longer. It may be more difficult to see your doctor during the fall. So get them in for sure in August when many people are not seeing their doctor. You want to make sure your kids, or away on vacation, exactly. You want to make sure that your kids are eating, as many different colors. I would say eat the rainbow. Different nutrients, different vitamins, a variety of different things, proteins, calcium, etc. The better their diet, and yours as well, actually. I think it's really important to model this behavior. You want to eat with your family. You want to eat a variety of things, and that will help keep your immune system strong. And similarly, exercising is really important. So most of us don't get enough exercise. The recommendation is that every kid and adult get at least 60 minutes of heart rate pumping activity per day, which many, many people are not getting. And again, it goes down to modeling. So, get outside with your kids, go to the playground, go for a bike ride, go for a swim, do something that will elevate your heart rate, because that will protect you from getting illnesses. And then getting enough sleep, too. So you want to eat a wide range of things, you want to exercise every day, and you want to get enough sleep. For adults, up to 10 hours a day is awesome. So lots of people talk about 8 hours a day of sleep, and for many of us that's difficult. But getting even close to 10 hours of sleep is even better. And for our children, getting 12 hours of sleep is ideal.
Yeah, and is that more important for kids because as they grow up at different ages, do they need more sleep at different ages?
So many people think that newborns need the most amount of sleep and then that decreases throughout childhood and adulthood, and it's actually not the case. We go through periods where we need more and less depending on growth spurts. Adolescents and teenagers need actually a lot, usually around 12 hours of sleep, as opposed to needing less, like many people think. They could stay up later and and that will be fine for them. But, newborns can sleep even up to like 20, 22 hours a day. But we're really looking for at least 12 to 15 hours in younger children, and then about 12 hours or so from like 5 to 12 or 13 years of age, and then even, continuing to have 12 hours of sleep ongoingly through adolescence. And as I mentioned, adults would really benefit the most from getting 8 to 10 hours of sleep, and many, many adults go with much, much less than that, which is not ideal for lots of things, for how well they think, how well, they focus and have memory, how well they function in daily life, social situations. We do better with more sleep for sure.
I wanted to go back to the question of disease resistance, and there's been kind of a school of thought that maybe kids are too clean and that houses are too sanitary, and that they're not building up the kind of resistance to colds and other things that they might otherwise.
So we do know that when kids are kept in too sterile of an environment, that actually can decrease their immunity. So you need to be exposed to different viruses and bacteria to get immunity to them, which is why kids in daycare will often get illnesses really early on in life, and then they're much more protected once they start school. They get less viruses then. Regardless of when you're exposed, you're going to get sick at some point because you need to get sick to develop that immunity. So regardless of whether that happens when you're 6 months old or 2 years old or 5 years old, if you get exposed to a cold, you're probably going to get that cold at some point. We also know that if you keep a too sterile environment, so babies that are there's bleach everywhere and they're hand sanitizing everywhere and everything is very, very sterile, they actually have an increased risk of what we call atopy, so asthma, eczema, and allergies. So you don't want too sterile of an environment. You want to be exposed to some things, but if you minimize exposure on a chronic basis, that will help you in terms of having back-to-back colds.
Yeah, and you raise another interesting point, and that is you need to get sick in order to be able to have your body learn how to fight these things off. How many times in a year should a kid expect to be sick, or should a parent expect their child to come home with a cold or something of that sort?
We expect that young children will have 6 to 12 viral illnesses per year. So when parents come and tell me, their kids just started daycare and they've had a cold this week and they had a cold last week, that's actually really typical.
And that is Pediatrician Dr. Dina Kulik. She has some ways to keep your children healthy as they head back to class in about a month now.